very good evening to you and welcome to this evening's episode of The Watchdog. My name is Vuyo Mvoko, and on the show this evening...
Left with no option but to commit Mr. Zuma to imprisonment with the hope that doing so sends an unequivocal message. In this, our constitutional dispensation, the rule of law and the administration of justice prevails.
We explore the landmark Constitutional Court decision that's going to see former President Jacob Zuma go to jail for 15 months. South Africa's former public protector, Professor Thuli Madonsela, shares with us her thoughts and hopes, but not before doctors, nurses and hospital workers who are on the front line in the war against the Covid-19 pandemic open up to talk to us about their feelings. As the nation battles a third wave of the scourge, they detail their fears, frustrations and aspirations. The Watchdog starts now. Now, their briefing may have been overshadowed by the Constitutional Court ruling that saw Acting Deputy Chief Justice C.C. Khampepe hand down a 15-month prison sentence for former President Jacob Zuma. But half a dozen ministers today addressed a briefing where they detailed what is expected of all of us in the 14 days the country is on lockdown adjusted level 4. Now, on your public service journalism show this evening, we bring you the voices of those who will be examining us when we fall sick, taking care of us, cleaning and maintaining the health facilities that we may have to visit. Let's welcome Dr. Angelique Coetzee, who is the chairperson of the South African Medical Association. Mike Chingange is the first deputy president of NEHAWU, and Mbuso Shozi is the provincial chairperson of Hospesa. Good evening to all three of you, and thank you so much for coming through this evening as we, of course, as I've just explained, continue to examine the other issues, attendant issues outside of what the government, the Command Council, the cabinet and everyone else may be telling us on a day-to-day basis. Now, yesterday, I had a conversation here on the show with the General Secretary of the Treatment Action Campaign, where they were talking about reports that they have been receiving from at least 3 provinces now. Those are the 3 reports that they've been able to come up with so far, where over this period of the COVID-19 pandemic, they have observed what they believe, what they see to be a disturbing trend, where people who have to go to hospital, who have to get medicines in the area of HIV and AIDS, as well as tuberculosis, are not really getting the kind of cooperation that they need or deserve, especially from public health facilities. Now, we thought tonight we could then have the 3 of you talk about how nurses, doctors and general workers at hospital facilities are coping. If I may start with you, Dr. Coetzee, how are the doctors feeling as we confront this third wave?
Good evening, and thank you for asking. And I'm so glad that tonight I can speak on behalf of the doctors, and I have colleagues here that will also speak on behalf of the nurses, because in my mind, the 2 of us goes together, because I can't treat the patient in a hospital without a nurse, and the nurse can't treat the patient without me. And I always feel as Sama that I always need to bring the nursing staff in. So I'm happy tonight to tell you what the doctors are experiencing, but I can promise you the nurses will be the same. So what we are seeing, it's what is currently happening, is the emotional fatigue that we are experiencing under doctors. You need to understand, this is the first time I've been 33 years in private practice. First time in my life that I have been encountered such a dilemma, what I am currently seeing. And what I do know is that our country is extremely poorly prepared for any pandemic. We have raised many times before from SAMA's side that there's a lack of good quality trained physicians that can work with pandemic diseases that might arise in a pandemic, and that there is not enough. There's not enough doctors, and the same goes for the nurses. So what people doesn't understand is that with a pandemic, or what we are seeing now with COVID-19, in your ICU and high care, you need nursing staff that is highly, highly trained. You cannot take a nurse from theatre or a nurse from pediatrician ward and put her into the ICU and expect her to treat those patients. They are with patients the whole day. The doctor comes in, the doctor gives instructions and expect that to be happening. So if it's not happening, the onus comes back to the doctor. You're putting up the doctor for failure, but you're also putting up the nurse for failure. And the emotional damage that this is causing to people, knowing that they can't do the job, they're not properly trained, but they don't have a choice, is going to cost us dearly going forward. When I hear that they want to put interns in the front line, my heart goes out to these interns, because they are the youngest and they're the lowest in the rank. And I can just think for myself what will happen to these young doctors and how disillusioned they're going to become if they pass through this pandemic and this third and fourth wave that's still waiting for us. It is totally unacceptable on an emotional status. On top of it, I have not seen that the department has trauma counseling put in place, compulsory trauma counseling, compulsory leave after you have done, let's say, 6 weeks of very, very hard work and long hours, just to give them a break. The doctors and nurses are becoming like an automatic soldier. You just go on, you switch the automatic on, and there you go. You forget anything around you. You can become totally, totally distanced from your patient. Unacceptable. We are not training people to become robots and forget the human element. Because if they do see the human element, they will not make it, because there's not enough care or infrastructure for you to address the problems that you are seeing.
Okay, Doc. Let's hear from you, Mike Shingange. What are your members at Nehau telling you?
No, thank you very much, for you, and good evening to my colleagues. Firstly, I must say that I speak for all healthcare workers, not just nurses. We organize everybody from the doctors. Perhaps the first thing that we need to acknowledge as a country, that the healthcare system in this country, as Dr. Gutsi have been saying, has not been really ready and prepared to deal with any pandemic. And I think COVID-19 has now compounded and exposed the unpreparedness of the South African healthcare system, particularly the two-tier healthcare system that has got both private and public. The second thing is that we have an anxiety. We've got what we call fatigue as things stands now. We've got healthcare workers have not gone to leave since February 2020. Workers who have seen their colleagues die around them. Workers who have contracted this virus themselves. Workers who have had less training as we speak for now. Workers whose morale is actually very down. The problem of the public healthcare system in this country, particularly when it comes to the infrastructure and the understaffing, it has not started because of COVID-19. It has always been there. We have always had not adequate nurses in the wards, not adequate doctors in the hospitals, not adequate cleaners and porters and people who can do the sluice in the wards. So actually, with the burden of diseases that you spoke to yesterday, that they actually have taken a back seat now because of the COVID-19. We are also seeing in overwhelmed the public servants, in particular in the public health, that actually are now less than they were at the beginning of the COVID-19 last year, because some of their colleagues have died. We have fewer public health workers today than we had in March last year. We have a situation where the nurses and the doctors and everybody else in the hospital have also to deal with the question of infrastructure, rather than only focusing on the issue of their profession. They now have to deal with the infrastructure in the sense that there are no beds unlike in the private health hospitals, public health care workers can't turn away patients when they come to the hospital and find that there's not enough bed. They can't. They're unable to turn away patients. In other words, they're supposed now to provide a substandard public health care system to our people. So that's one of the things that not only it frustrates them that they are not able to help their people, but they have a fatigue. Dr. Kutse spoke about trauma counseling. We have always called as NIHAO for a very longest time since the start of the pandemic what we call a psychosocial assistant. The traumatic situation that these workers go through when they were confronted with this thing needs that from time to time they need to be debriefing, they need to be psychosocial supports. The fact that themselves, when they are affected and they go home, within 10 days they're supposed to come back to work, whether they are fit or not, they're supposed to come here. And now they have to combine with an advent of the third wave, a Delta variant that found us again not having learned lessons from the first and the second wave, found us not having learned lesson in terms of preparedness to deal with this third wave. It's actually an indictment. I don't want to come about the morale of the fact that when people who are 60 years and old, and the people who are deemed to be non-essentials, and the people who are just supposed to go for leisure, are called upon and be told to go and close themselves behind the doors because there's a danger lurking out there. In other words, people, when they get to public transport, they go to transport intersections, they go to the crowded workplaces, they are themselves the risks for themselves and their families. They are not being compensated. There's no danger allowance that is being given to them. But they are working, having to force to confront a danger. They are not so lucky that they can go and hide, just like everybody else. Now we're in the fourth level 4. We are told to hide ourselves behind the doors and not travel. But these workers are not so lucky. They have to go to public transport. They have to confront people who are sick on a daily basis. They are fewer today. They are tired. They are not being trained. They are not being incentivized. In fact, they are spending 35% of their salaries to transport themselves to go to work. And yet they're also taking a salary cut of more than 5% since last year, 2020, when they didn't get a salary increase. So this is one of the things that our members are telling us. The hospitals have got fewer cleaners today. We expect them to be clean. We expect them to be so that we can manage the infection control. They don't have running waters, most of them, as we speak today. They don't have porters. Nurses have to double up and wheel up the patients when they're supposed to go to the wards, because the hospital is not employing more porters today as we speak today.
Mbuso Shozi, do you have is experience different from that just described by Mike Shingange and Dr. Kutsia?
I am mostly covered with what my colleagues has raised, Buyo. However, there are issues that really are most challenging. Some of them are the lack of support to the healthcare professionals. So they are lacking support from the government itself or from the employer itself. So they are not being appraised in everything that they are doing. They are sacrificing. They are coming in numbers to work, hoping that they are going to be compensated at the end of the day for the work that has been done. But there is nothing that is being done so far. There is a lack of increment. They've never been given increment so far, but they are working. They are expected to execute their duties. They are not happy, actually, based on the fact that there is high influx of patients that they have to take care of, but nobody is appraising them. Even on the issue of PMDS, so where they are supposed to be appraised by employer. So employer is rating them 3. However, they're working with skeleton staff. They were short of staff as from April last year, actually from March last year, up to so far. They were working with skeleton staff. However, there was a circular 23, I mean, of 2020, where they have to hire some staff members to come and assist in temporal basis. Unfortunately, the issues of quarantine, they also emerge. So at the end of the day, we are running short of staff. So I'm saying we are having a lot of challenges, lack of appraisal, the issue of compensation. So our members, they were expecting to be compensated for working while everyone was on lockdown level 5 last year, but nothing has been done. Now we're at level 4. So the level 4 doesn't say people must not come to hospital. People are coming to hospital in numbers. They only close alcohol and long traveling. But people are coming in numbers to hospital in daily basis. So you can go to hospital in the morning. You will see people in the queues. Currently, it's even hard to separate COVID patients to normal patients because they have to go and screen everyone. Everyone will be only seen at the outpatient department, where you will find out that that particular person actually has tested positive at the clinic, so has been referred to the hospital. So it's a challenge. As we speak, our members, most of them are on quarantine as we speak. So really, it's very much challenging. So the infrastructure, it is still the same as it was before 1994. There are no changes. We are faced with same infrastructure, a lack of staff shortage, and nothing is being done. So really, it's very strenuous. Very strenuous to our members.
Now, I'm going to ask both you, Mbuso and Mike, in your engagements, in the last engagements you've had with the employer, what has been the attitude like, and were there any promises made that these issues which you say have been, there for the longest time, have there been any promises of doing something?
No, if I were to start.
Okay, yes, okay. Mike, you can go, you can come in, yes?
No, you remember that actually, as Nihao, at the beginning of the pandemic, we had to take the Department of Health to court because they didn't believe that the things that we were talking about were actually true. They didn't believe that actually we had a level of unpreparedness as a department to respond to the pandemic, number one, but number two, to protect the frontline workers who were sent out there to be the soldiers that are supposed to defend the nation. Many of them have died because we provided poor quality of the PPEs. Many of them have died because the department denied that we did not have PPEs. It was only after we actually embarked on what we call a fact-finding mission, a program that we came back, identified that the department, the hospitals have been forced to scale down the number of the people that they admit and the number of people that they see in OPDs, particularly on the other chronic diseases that the public health system will normally be providing to our people, which also have got a long-term impact, even post-COVID, should we do that.
Did the court process help?
Sorry?
Did the court process help?
Well, the court process helped because we were forced to sit down and talk. And then we were forced to have task team together with the department for them to be together to see that indeed on the ground the things that we have been raising, that's correct. That firstly, we do not have enough PPE. Secondly, we do not have enough staff. We have got a hospital that requires 27 cleaners, only have 7 now. But we expect the hospital to be clean, quickly clean, so that the hygiene can be maintained. But at the same time, on the issues of compensating the workers, what we call the circumstantial allowances, surely, as you know, the attitude of the department or the government towards the public servants in general at this time, public health in particular, it was simply that we have no money. We don't think we should compensate these workers for risking their life in defending the lives of the nation. So indeed, the workers are not being compensated.
Okay, Mbuso Shozi, did the establishment, or was the establishment of facts, which Mike Shingange has just described, did that lead to action or any form of action? Has there been an improvement?
There is nothing, sir. Actually, let me make it clear for you. The employer that we are talking about, we are talking about the politicians who doesn't care about the lives of people, who only cares about their 5-year term that is before them. This is number one. So I will speak frankly. because our union is non-politically aligned. So it must be very clear. We are faced with the mafias who doesn't care about the lives of the patient, of our staff members, of our members as well as the patient. So all they care about is what is supposed to be done at the end of the day. So honestly, we have raised a lot of issues, as my colleague from Nehao has alluded. We have raised a lot of issues. So the issue of compensation fund, we were told that they will deal with the compensation only at the end of the COVID-19. Tell me when is going to be the end of COVID-19. We were talking about the issue of paying a risk allowance to our members. They said that will be paid at the end of COVID-19. We were talking about the increment. They brought forward 0% increment as things stand. So later they came with 978 plus 1.5%, of which is part of the pay progression of our members. So really, they don't care. They don't care. The issue of staff shortage, it was raised long ago. Even now, it's still the same issue. From 2011, 2013, 2015, 2018, it's still the same issue of the staff shortage. So really, it's challenging. There is no improvement, actually.
Dr. Kutsie, have doctors had any luck compared to nurses and general workers and everyone else?
No, SAMA is not a political organization. We are an advocacy group and trying to work through that avenue. But I must say to you tonight, we have tried. We have tried with the DG. We have tried with the MEC of Health of Gauteng. We have tried with the MEC of Health of Eastern Cape, the acting one. We have tried with KwaZulu-Natal. I think either they are afraid to meet with us, or it just shows us the lack of deterioration of their departments by not even acknowledging our letters. And the one did acknowledge us, but we're still waiting. So if that type of behavior is happening, we think each and every one is important. Whether you are Hospersa, whether you're Denosa, whether you're Sama, whether you are the cleaner. In the end of the day, we are paying, as taxpayers, the monies of people sitting in these governmental structures. And if we have a problem, you should actually meet with us, and you should start listening to us, and you should start putting politics away. Because in the healthcare sector, we're not working with politics. We're working with viruses, bacteria, fungus infections. We're working with people, real people. We see them. We see the sorrow, the cry. We go through them with all their hardships. We understand what is happening at ground level. And when organizations like SAMA or any of the other big organizations like Nehao or the NOSA or Hospersa, when we are saying there's a problem, you must actually know it's nearly too late. And by not acting and not working with us, why should we always demand? Why should we have to strike? Why should we have to do all these unnecessary things to be taken seriously? Why on earth aren't we not good enough? Are only politicians right in healthcare? Because healthcare is lives. We're working with lives of our own people in the healthcare, the workers, and the lives of the patients. Whether you are public sector, whether you are private sector, patients go where they have money today to go to. And each and every one of us would like to have good healthcare services. Not this nonsense that's currently happening.
What sort of coping mechanisms, Dr. Kutsie, have you, yourself, and of course your colleagues, people you work with, had to employ, especially during this time of a pandemic? How has this affected your work, really? Have you been doing less? Have you been avoiding? Have you had to avoid, treating people? The real practical, the effects, of, the situation that you've described on the patients that you have to help at the end of the day.
We are actually working harder because, as it was mentioned earlier, there's less doctors. The doctors died in the second wave and the first wave. So we have less experienced doctors. So if I take myself, I work very hard. Like now, I'm still sitting in my surgery. I haven't gone home yet. After this, I will go home. Then I have to feed the dogs. I need to see that my mother, who is extremely ill, she's been fed. I need to see that my husband is okay. I need to make sure that I don't bring COVID home. I don't sit with them. I go in, after the feeding the dogs, I go straight to shower, get into bed. Then I start with my laptop and look at all 200 messages that I got today that I hadn't had time. So what do? I'm switching off. Emotionally, I'm getting irritated if a patient come and sit in front of me and say to me, oh, I've got a backache for 2 months. I want to say, why the hell do you come tonight for the backache? It's 2 months. It's in the middle of COVID. You should have taken a painkiller. That is what I want to lash out to the patient. But it's not right. So I have to swallow it. I have to take a peptic ulcer tablet for the last 2 weeks because I'm worried about my patients that cannot be admitted, who need oxygen. There's a lack of oxygen after we have been promised that there will be enough home oxygen. I need to look them in the face, the families. I need to make a plan. Can I take a lot of this? And I'm a very strong woman. It's getting to me. So if it's getting to me, how much more will it get to a young doctor who's totally inexperienced? I don't think people really understand the life of any of the doctors currently out there. And again, I speak here for the nurses as well, because in the end of the day, we are bound together, as I have said. I can't work without the nurse, and the nurse can't work without me. We are a twin. But it's time that government starts to look after us, because what's going to happen? They're going to leave medicine. They're going to immigrate. They're going to immigrate into another NHI system. Not because they don't like NHI in South Africa, but they trust the other system more, because that system at least is giving something back to them. They know there will be hardships. But here in South Africa, we're not appreciated. We are here, we have to do the work, and that should stop.
Mike Shingange, from your vantage point, the unintended consequences of the conditions under which your members have to work on unsuspecting and innocent patients, what are you hearing?
Of course, like I said, there's a lot of anxiety. So the unintended consequences is that at some point something will have to give. In other words, something will break, not out of the own volition of the workers. I think our members are very committed. They are not leaving the country, are not going anywhere. In fact, they've been demanding for the national health insurance here in the country, which includes properly staffing the institutions of public health, including, by the way, appointing all the community healthcare workers that are the ones that are supposed to go on the ground and do the massive screening and testing. Currently, are the ones that we rely on to go to the people who are now expected to spend something that they don't have in order to access a service that is for free. For elderly to go to vaccination centers, they have to spend money they don't have in order to go and access vaccination that is supposed to be free. But if we had these community healthcare workers that have been employed and go on the ground and be the one that do the testing, screening, and vaccination, this thing will be fine. Unfortunately, one of the other unintended consequences is that we, as a country, have not even completed the first phase of vaccination that was aimed and targeting the public health care workers. We are now on the other phases which are very equally important. They must actually go simultaneously. But we at least need to know and give confidence to the South Africans that at this point in time, we think we shall have completed vaccinating all the frontline workers, in particular the healthcare workers, because they are the ones who are on a daily basis confronted, coming into contact with people who are sick. So if we're not paying attention and prioritizing that, everything else that we are trying to do is actually going to be a futile exercise and be defeated. If you have got soldiers that are supposed to defend the nation, like the healthcare workers, in their own barracks, which is the hospitals, with their workplaces, being victims themselves of this pandemic, which is an enemy of the humanity, being attacked, then our chances of defeating and winning this war is very slim. So that's an unintended consequences of not paying attention to strengthening, capacitating, and staffing, and even incentivizing in terms of motivation the public health care workers, and making sure that you have got a number of public health care workers, because there are a lot of professionals that are sitting at home today that are not employed. But we are running short of nurses and doctors. We're running short of porters. We're running short of people who are supposed to be helping our people out there. The pandemic is wreaking havoc in the country, but we're just not, we're burying our head in the sand. We're not that being responsive in terms of getting our boots on and making sure that we defeat and defend the nation.
Mbuso, have there been no, what do I call them, sort of alternative ways or means of dealing with some of these problems? I'm thinking aloud here that hospitals are full of these, professionals, or have professionals who can provide, psychosocial assistance, for example. Is it completely impossible to get some of these services extended to the very workers who are in hospital?
Number one, we do have the so-called employee wellness program in all the institutions of health. Mm-hmm. However, at this stage, the wellness program is no longer dealing directly with emotional issues of members, but is dealing directly with testing of people. Our members are not even getting counseling if they get infected. If I can tell you right now, members have been vaccinated, but they still get infected. This chop and changing of vaccines day in, day out is not working for us. And those members, they go to wellness, they go and test. After that, they are being informed to go and stay at home and wait for the results. The results come back positive. Then they have to sit at home for that particular 10 days. They come back and work. No one will call them and check on them. How are they doing? How is the family? So are they coping? So there is nothing like that. And unfortunately, even the very same wellness program is faced with the similar challenges itself. So it's a bigger challenge. So yes, at the provincial level, we do have some committees, OHS committee that is being spearheaded by the HOD of Health in Gauteng province. All unions are sitting there. So, but that committee at this stage is dealing mostly with the issue of staff rotation in terms of any level, as we are changing levels now and then. It's also dealing with issues that affects members in terms of PPE. So to ensure that there is PPE, to ensure that there are committees in each and every institution, to ensure that members in those institutions are being informed of the issue of PPEs in their institutions, on how to don and doff the PPE. But still, that is not enough, simply because the very same infrastructure doesn't allow. The very same issue of staff shortage doesn't allow. So that's the challenge. But yes, at the provincial level, there are those type of assistance. But the problem is the national health. The national health, really, they need to do something. Otherwise, the healthcare system is going to collapse in the verge of our eyes.
Okay. Quick last words from you, Mike, and Dr. Coetzee. Mike?
Well, like I've said, it is high time that the public health workers stop receiving only the token of appreciation through words that Shem, we are with you. We think that the society and the governments need to start to be caring.
Okay.
2, we need to move with the necessary speed to complete the first phase of vaccination so that we at least know that we are having immune public health care workers that can defend the nation. And thirdly, we need to move with speed to resource the workers, because workers need to be resourced, but also the staffing need to be up to standard, that the response to the growing population and the growing sick population, because over and above the coronavirus, there are many other burden of diseases that we're supposed to look into that. And we also think that we must now go back to this thing of the field hospitals that were created earlier on, because it is a fact that our hospitals are now becoming full. Our public health care workers are becoming overwhelmed, and they can no longer cope with the burden of disease that we are facing now.
Quick one, Dr. Kutsia.
I think it's time to take us serious. All these organizations out there take us serious, from the National Department of Health, Treasury, as well as any other department dealing with healthcare matters. I care for you when you are sick. It's time that you care for me.
Okay.
And it is true. We are all important.
Thank you so much, Dr. Angela Kutsia, who is the chairperson of the South African Medical Association. Mike Shingange is the first deputy president of Trade Union Nahau, and Mbuso Shozi is from Hospesa. When we return from the break, Advocate Thuli Madonsela joins us to unpack the judgment handed down by the Constitutional Court against former President Jacob Zuma after his refusal to honor the summons issued to him to appear at the Commission of Inquiry into state capture. Don't go away. Welcome back. This is the Watchdog. My name is Vuyo Mvogo. Now, former President Jacob Zuma, the court today decided that he should go to jail for 15 months for contempt. And joining us now to just talk us through what went through her mind when as she was watching as Judge Sisi Khampepe delivering this judgment, and of course the implications that today's events may have on the national psyche, but also on some of the political players that we have in this country, given our history. Someone who is, of course, no stranger to these sorts of issues, because as a former public protector, she has had to dabble in these matters quite a lot in the years that she had to do that job. Thank you very much, Professor, for joining us this evening. The court's departure point is that if you hold the courts in contempt, there's a price to pay. And that applies to everyone, irrespective of who you might be.
That's true. That really is the central message in this Zuma judgment, Vuyo. Firstly, thank you for having me, and greetings to everyone. The courts are making it clear, and the Constitutional Court, being the apex court, is making it clear that nobody is above the law, and that for the rule of law to operate, though, we all have to obey the law, and this includes obeying court orders.
Now, there are people who say, if we look at the commentary, what people are saying on social media and everywhere else, that former President Jacob Zuma invited this upon himself, and therefore the court was left with no option. But that, of course, hasn't stopped his family and supporters from suggesting that he has been singled out.
Well, you have to have a heart of stone not to feel sorry for President Zuma, given the fact that he has to go to jail at his age. That he has been singled out, definitely no. I think the courts have been bending a little bit backwards to meet him where he is. For example, in this particular case, the Constitutional Court invited him to make a representation on sentencing, even though he had chosen not to engage with it on this particular matter. And that shows that the Court of Law thought it was important to hear his side of the story.
I'm going to play a clip from from Justice Kambebe delivering that judgment, but specifically talking about the Constitution and why, as the bench, they felt that the point needs to be made that no person is above the law. I'm going to play that clip in a second. But there was also something there where one felt that the Constitutional Court felt the need or deemed it necessary to also delve into the meaning of and implications of sending the former president to jail, even though they still believed that he actually brought this upon himself. Okay, that clip is coming, Prof. But just your comment or your thoughts on why you thought, or also if you saw it the way I did, that the court really went out of its way to really speak to those issues, that sending this former president to jail obviously has implications for the country, for broader society, even though they still felt, and she said this repeatedly, that he's responsible for how things have panned out.
Absolutely. Democracy, as Justice Sandile Ngcobo once said, is an ongoing dialogue between those who exercise public power and the people. And part of that dialogue is between the judges and public representatives. And in this particular case, the Constitutional Court, I suppose, had a really difficult job, knowing that President Zuma is a politician, knowing that he's old, knowing that sending him to jail is going to pain any human being who will feel sorry for him as an elderly statesman, but also as somebody who fought for the struggle. But at the same time, they knew that they have a higher job, which is the job to be the guardians of democracy, and that if they let go of their responsibility, or if they failed to discharge this responsibility, democracy could fall apart. As Adam Smith said, justice is what holds society together. And when justice fails, everything falls apart. And justice demanded that President Zuma be treated the way we would have treated a Sandile Dlamini, a gardener, if this is how he had treated the courts with contempt.
The higher job to protect our Constitution, which, as many people have been saying over and over again in their dealings with the former president, it is the duty of all of us to actually protect the Constitution, isn't it? And that includes him.
Absolutely. And of course, for people who are public representatives who have sworn to uphold the Constitution, that duty is even higher. So the duty applies to President Zuma and to the Constitutional Court as well.
And this is important because, and I'm raising this because, Judge Kambebe was saying the damage must be stopped now, to use her words. You can't make a mockery. I think mockery was the word she used, of the court and its judicial processes in the eyes of the public. So each and every one of us has a responsibility to protect the Constitution.
Absolutely. And the courts ultimately have a higher responsibility. And the Constitutional Court has a lonely journey, or a lonely job of being the ultimate guardians of the Constitution. Because if they fail, everything we hold dear is going to fall apart. As Adam Smith said, President Nelson Mandela once said, even the most benevolent of governments have within them people with propensities for human failings. And that's why we've got courts and all of these other innovative structures to make sure that people are assured that when they're not happy with the way they're governed, when they're not happy with the way their rights are dealt with, they can always have a guarantee that their matters will be dealt with properly by these structures. And had the courts failed here, it would have sent a message to Gogo Dlamini and Nkofi Mbaba that if I have a case against a powerful person, the courts will not be able to help me. And this would encourage everyone to take matters into their own hands.
Okay, let's take a listen, and Prof, to that clip I wanted us to play. It comes very neatly after the point you've just made.
No person is above the law, and every person, whatever be her or his rank or condition, is subject to the ordinary realm of the law and amenable to the jurisdiction of its tribunals. An act of defiance in respect of a direct judicial order has the potential to precipitate a constitutional crisis. If with impunity, litigants are allowed to decide which orders they wish to obey and which they wish to ignore, then our Constitution is not worth the paper upon which it is written.
Now, Prof, you know, whatever, what the judge just said, in my view, you can correct me if I'm wrong or if you hold a different view, it would not have persuaded anyone who held a view before today's judgment about what to think of the former president. In other words, a person who went or who before listening to that judgment had a particular view of the former president would not have been persuaded by what the judge said today, because pretty much a lot of people have made up their minds about who or what they think of the former president. But do you still think that the comments the judge just made to at least the other people who may not have formed an opinion of the former president would help locate these conversations in a very proper context, and perhaps lessons would be learned? And I'm talking now about those of us who are not very as close to these processes as many South Africans or other South Africans may be.
No, that's true, that a lot of people have closed minds and they only listen to answers to questions that resonate with answers they already have. But having said that, I think I'm a little bit more optimistic than you, Vuya. I do think that it's not only people who are supporters it's not only people who are not supporters of any of the so-called factions that will resonate with this judgment. I was on a panel earlier in one of the TV channels where I just found that the lawyers were open-minded. Pretty much everyone on the panel agreed that a judgment of contempt of court was inevitable. And pretty much everyone agreed that to be equal before the law and for the rule of law to be upheld, there had to be punishment. And at the end of the day, there were only two issues where there were differences of opinion. It was the harshness of the sentence. Should it have been 6 months or 15 months? And also, should it have waited for President Zuma's challenge of the presiding capacity of the Deputy Chief Justice, because he alleges that the Deputy Chief Justice is now conflicted.
I want to talk lastly, Prof, about just listening to or reading the judgment. A lot of people have been waxing lyrical about how lucid it was, morally sound, how it, pressed all the buttons. Just your thoughts on how this judgment was written, the lessons we need to learn about, how to, how we should go forward on these sorts of things.
Absolutely. I think everything that has been said in the words that you've used to summarize people's opinions of the judgment is what I agree with. It was a lucid judgment, well written, covered all bases, and it really was a seminal judgment on the rule of law and on our duty to obey court orders. It also was a lesson on what happens if people are allowed to cherry pick. I will only obey this judgment. I will only appear before this judge, because then the rule of law falls apart. And when the rule of law falls apart, democracy crumbles. And the Constitutional Court went through that. It also went through the whole question of politicians just having a picnic at attacking judges without any shred of evidence. And therefore, this judgment is also saying to people, think before you act, and you ignore courts, you ignore court judgments at your own peril.
A lot has been said about the minority judgment, which, even though it was just as emphatic that the former president was actually in contempt of court. Your thoughts?
Well, the minority judgment took issue with some procedural issues. But just firstly, some people don't understand what is the value of a minority judgment. In courts, the only judgment that has legal status is the majority judgment. But the value of a minority judgment is that in future, people can at least use some of those thoughts to argue, and therefore they have some persuasive value. In this particular case, the minority judgment was concerned about the fact that, among other things, about the fact that maybe a custodial sentence was not the right thing to do at this stage. But secondly, that maybe the matter needed to be sent back to the prosecution to be prosecuted. However, the majority judgment took into account the kind of behavior that we've seen from the former president, that if you send this matter back, do you realistically expect a different outcome? But secondly, what happens to democracy? What happens to the rule of law, given the fact that every day it's being assailed? So they had this unenviable task of walking in the shoes of President Zuma and trying to be empathetic towards him, and yet carrying the nation with them, and the hopes of the world about South Africa in making sure that this one person's actions do not throw the entire rule of law project into disarray.
Prof, thank you very much for your time this evening. That's the former Public Protector, Professor Thuli Madonsela, sharing with us just her thoughts, but also hopes about our country on the back of what she calls a seminal judgment that was delivered by the acting Deputy Chief Justice C.C. Khampepe. And that's all we have for you this evening. Do join us again tomorrow evening when we will be in conversation with the Auditor General on the back of a report that she's going to release tomorrow about the state of local government finances in our country. Do join us again tomorrow. Have a good night.